Hi, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we are diving into all things telehealth, including policy, regulatory environment, reimbursement. And we are talking to this guy right here. He is Kyle Zebley. He's the Senior Vice President of Public Policy at the ATA, and he's also the Executive Director of ATA Action, which is the affiliate advocacy organization for the ATA. So, Kyle, I'm excited to talk to you. We've got a lot to talk about.
Thank you so much, Jess. It's great to be here.
Well, it's great to have you here, and I'm excited to jump in and kind of find out where we're at as we wrap up this year and head into 2023 with the top things we should be concerned or excited about moving forward. Before we get to that, though, I do want to shout out our sponsors who have brought us here together for this conversation. This is brought to you by Wheel. It's another episode in our series of Wheel's Virtual Care Regulatory Roundup. And for those who don't know, Wheel is a health tech company that is powering the virtual care industry, and they provide companies with everything they need to launch and scale virtual care services, including the regulatory infrastructure to deliver high quality and compliance care. All right, so Kyle, on that note, high quality and compliant care, those are the table stakes here. And so I know the ATA has done quite a bit to help ensure that the ability for us to deliver that kind of care is still out there. What I want to start off the conversation with is what's on your radar? So I know that ATA, you guys have your big policy conference coming up next week, December 7th through the 9th in DC. So if you guys want to go, check out the agenda, pretty packed, learn all about the big state, federal policies that are going to impact telehealth and virtual care moving forward. So, I mean, hit us with the big themes of the conference, Cal. What are the top three things that we're facing right now in terms of making sure that we don't fall off that telehealth cliff?
That's right. Well, there's so much going on, and we really are trying to do our best to make sure that telehealth is here to stay and that no American goes off that telehealth cliff that you just mentioned. Next week, December 7th through 9th at Edge, we'll be really handling all telehealth policy issues from every angle, federal, state, and international. I would say for me, the big three priorities as we really look at where things are here in late 2022, it's one, making permanent pandemic-related flexibilities that are conducive to and very friendly towards telehealth broadly in federal programs, areas where Congress and the administration have the ability to really make these favorable telehealth policies at the federal level permanent. Number two, it's to make sure that telehealth is really being treated as just another area of the U.S. healthcare system, not something separate and apart. So leveling the playing field in particular, we want to do that in terms of state policy. And then number three, I would say really importantly, it's an area where the federal government and the state governments can work very productively, is making sure that we're breaking down interstate barriers to care. For a variety of reasons, political and constitutional, there is a real ability for states to determine for themselves who's licensed and able to practice in their state borders. However, there are a number of different ways that we can break down barriers to care so that we can make sure licensed medical professionals can deliver care across state lines. And so it's trying to make sure that we are using every tool at our disposal to break down those barriers.
All right. I want to double click on all of that. And I think the way I would like to go through it, if you don't mind, is to go backwards, because I think that issue of state licensure is just, that's always the one that keeps coming up. And it really is, it's something that came out of the past. In fact, I got a nice history lesson about it from Z Rotano from Roe in our last episode of this virtual care regulatory roundup. But talk to me about that issue. I mean, and for those who may not, I mean, I feel like everybody in our space is pretty well aware of the fact that it's like who can practice in what state is determined by the state. What do you think the sentiment around changing that is? Like, is there enough appetite among those lawmakers who have the propensity to change that legislation to change it right now? Or are they still looking at that as something that needs to be kept in place?
Well, I think there's been a really huge degree of positive momentum coming out of the pandemic towards breaking down those barriers and to make sure that states adopt policies that allow for out-of-state medical professionals in good standing to deliver care to the citizens of their state. And the reason for that is, first of all, the vast majority of states, more than 40 states, of the 50 states, implemented policies early in the pandemic that made it easier for out-of-state medical professionals to deliver care to their citizens. This was done through kind of temporary executive orders, all of which have since expired, but all of which, when put in place, did not result in the sky falling in. Instead, they increased the number of clinically appropriate options for the citizens of the states that adopted those types of policies. So we want to see states really make permanent a lot of those favorable provisions that came about during the pandemic. We want states to adopt licensure compacts. Adopting those compacts allow for the various medical professionals to deliver care across state lines. We want states to adopt innovative models, for instance, the registration models that Florida and Arizona have adopted that allow out-of-state medical professionals in good standing to get registered and deliver care in the states in question. And we think there is a role that the federal government can play in incentivizing, through a carrot and stick approach, states adopting these types of policies that will be reciprocal in nature. I'll just also highlight the fact that there's a real great deal of energy that's gathering around the idea of perhaps making common sense exceptions to strict enforcement of licensure that will increase options for Americans. For instance, the Federation of State Medical Boards came out with the Model Telehealth Policy Act, and the Uniform Law Commission came out with the Uniform Telehealth Law that went through a lot of really common sense areas in terms of second opinion consultations or follow-up care or receiving care in another state when you're on travel, you're a tourist, you're out of state for work, you're a student. A lot of areas where a lot of reputable bodies are starting to see where there could be really common sense exceptions that would increase access to care in a clinically appropriate way, to making sure that there was all these layers of protection in place along the way.
So is this, do you think, likely to be the approach moving forward, more of these common sense common sense exceptions to this, so that there is the ability to do these types of things? Or is this unfolding in a way that's maybe a little bit more nuanced than perhaps I understand or that others understand, in terms of, like, you hear about different subspecialties of medicine, for example. I always feel like mental health is looked at as the gold standard use case of telehealth delivery, right? And there's a real supply and demand issue there between people who need that type of care and people who are able to provide it. And so in that case, people seem like, okay, yeah, across state lines makes total sense. But then you maybe turn to something where more hands-on care is needed, or if there are follow-up appointments or things like online prescribing where there are some other nuances there. Can you just unpack that a little bit more for us? So is it like a one-size-fits-all thing will come out of this, or will it be just a series of exceptions based on use, and as people get more comfortable with virtual care? How do you think this will unfold?
Well, it's very nuanced, but I think that the positive momentum is definitely on the side of those that want to break down barriers. And for us, it's an all of the above approach. Also, for the HCA, we think it's going to be an approach that will continue to have to be on a state capital by state capital basis. Even if the federal government plays a role, at the end of the day, state governments have to proactively seek out adopting these favorable measures. It's all the above because really we're asking states to do a number of things. There are 7 or 8 licensure compacts for various medical professions, including SciPact, for instance, for psychologists. We want states to adopt all of those compacts. We're supportive of all the compacts, which are broader than just telehealth, but obviously include telehealth and are very favorable to telehealth. We want states to adopt those registration models that I mentioned, which are in no way contradict or replace the compacts. We want states to adopt these common sense licensure exceptions that we mentioned, that the FSMB and the ULC have endorsed. Why would states do this? Because the technology is obviously there. It's technologically possible to deliver care across state lines. So that's important. Secondly, the standard of care can be met virtually in a whole host of circumstances. And all we're asking is, let's empower licensed medical professionals to work at the top of their license in delivering clinically appropriate care within the standard of care to patients across the country. We know we can do that. There's reams of evidence of that, including all those flexibilities that came about that are tied to the pandemic that showed, again, like I said, sky didn't fall in. And then again, there's also this huge issue of making sure we have the workforce that can deliver the care. We're in the midst of the Great Resignation, exacerbated by the pandemic. We're in the midst of an aging general population that's being traded by an aging and retiring health care workforce. So how are we going to make sure that we can correctly match up the resources with the need if we don't deploy telehealth in all its efficiencies, and we don't allow for telehealth to do what it does best, which is really allow for the provider to meet up with the patient regardless of the geographic location of the provider or the patient. And so really it's inexorable, it's inevitable, it needs to happen if we're going to really make the most out of the limited U.S. healthcare workforce and resources that we have. We've got to make sure that telehealth technology is available at every step along the way in an omnichannel fashion of the healthcare continuum. And so breaking down licensure barriers is a key component of that overall approach.
All right. I want to ask, don't worry, I will come back to omnichannel and its impact on this space. Before I get there, though, I do want to ask about the rest of those public health emergency policies that were put in place, because that was kind of how you kicked your answer off in terms of like the three big things that the AT is looking at right now to make sure we don't fall off that telehealth cliff. So what are some of the other ones? So state licensure, obviously a big deal, but there were a number of other things that were either lifted or modified in order to help make sure that people got the care they needed during the pandemic. And then those public health emergency policies got extended, and now we're looking like, okay, what's going to happen next? So what are like the couple other key features of those public health emergency policies that you really are concerned about making sure that those get extended and put into place in a more permanent way?
Well, I broke them into two categories in the initial answer to your
Yeah.
question of our three big priorities here at the end of the year. First are all the federal flexibilities that are directly tied to the ongoing public health emergency, or were policies that were directly tied to directly tied to the pandemic.
So for
So that
example,
includes, yeah, for example, for Medicare, there were a variety of flexibilities that allowed for any Medicare beneficiary to receive access to care where they were, regardless of their geographic location or originating site. These were waivers that are temporary in nature. They continue to be tied to the public health emergency. We want to make those permanent. We also saw the ability for federally qualified health centers and rural health clinics to get covered and get reimbursed for telehealth care. We want to see that made permanent. We want to make sure that a telemental health in-person requirement never takes effect because we think it's an added barrier to care. So we're seeking to make sure that in-person requirements repealed. There was a favorable tax provision that allowed for those 35 million Americans with high deductible health plans to take advantage of telehealth care. We want that to be extended past the end of this year when it's set to expire. Telehealth has been declared an accepted benefit during the pandemic. We seek to make that permanent. And then finally, I'll say, and there are other areas as well, but one big area of focus for us is the ability of licensed medical professionals with prescribing authority to continue to be able to remotely prescribe clinically appropriate controlled substances without an in-person requirement. There had been an in-person requirement in effect prior to the onset of the pandemic, and we want to make sure that these vulnerable populations receiving clinically appropriate care now do not have their continuity of care severed by a clinically unnecessary in-person requirement. So those are our big federal priorities. At the state level, I'll just say real quickly that the vast majority of states more than 40 states have adopted positive telehealth laws since the onset of the pandemic, really largely making permanent a lot of the favorable policies that were put in place early in the pandemic. That's been a positive change. We want to continue to make sure that we're leveling the playing field for telehealth so that we're not being held to lower standards, certainly not, but that telehealth is not being held to a higher standard as compared to in-person care. And really, states are where decisions about commercial coverage of telehealth and where decisions about the practice of medicine largely lie. Also, states are where questions around what Medicaid policies will and will not cover. Those are determinations made by state governments and state regulatory agencies. And so we want to make sure there's no that we continue that positive progress, and that there's no rolling back of the favorable policies that have come about over the last 2 years.
Okay, no, thank you very much. That really clears it up. I think what's interesting to me is like I joked to you about omni-channel care, and so I feel like omni-channel has become like the word of the year, and it's definitely something. Even a few weeks ago at HLTH at the health conference, hearing a lot about just incumbent organizations who up until this point had dabbled in telehealth and who had who had maybe looked at a digital health solution or whatever, and consumers who've done the same, or retail health providers who have kind of like played in that space but not really committed, to hear their plans, which are laid out so strategically now, and they're very much tied to this whole idea of creating a different kind of delivery model, omni-channel. Is that helping any of this from an advocacy side on the policy standpoint? Because I'm curious about that. Because I mean, on one hand, you have some of these people who definitely benefit from the in-person part of that equation, and so I could see where they might be pushing one way or the other. But then again, now they're standing up these omni-channel strategies, and while the number of telehealth visits, people keep looking at those, the number of visits, and they're lower obviously than they were during the pandemic, yet higher than they were pre-pandemic. But still, I'm curious to hear your thoughts. Do you think that these omni-channel models that provider organizations or retail health providers are starting to really talk a lot about, laud, actually promote, like sell to patients and to health consumers? Do you think this is helping from a policy standpoint, or do you think that somehow it's maybe not as helpful as it seems?
And I think it's very helpful, and I think it's yet further evidence that telehealth and remote care technology, omni-channel care is here to stay, that it's a permanent part of the U.S. healthcare landscape, that it's an option that providers want to have in order to deliver clinically appropriate care to their patients. And it's an option that patients want to have when they look at the options available to them for the care that they seek to receive. Most importantly, what's really important to understand is that at the end of the day, like I had said previously, telehealth and omnichannel care is really healthcare. It's not really all that different and shouldn't be that foreign a concept. It's licensed medical professionals determining whether or not a technology or modality of care is able to meet the standard of care when they decide to deliver that care to the patient. And when patients have options available to them, be it synchronous or asynchronous care, remote monitoring care, audio care, that those options have been attested to as appropriate by the provider in question. So it's not a question of the patient getting to seek out the care that they want, regardless of its clinical appropriateness. It first and foremost has to be clinically appropriate. So given the fact that it is, we want to make sure that every American has as many options as possible, and that policymakers aren't unnecessarily impeding and putting up obstacles to that access to care. I think that another thing that's really important to keep in mind is that telehealth and omnichannel care isn't appropriate in every circumstance. There is always going to be a need now and in the years and decades to come for professionals to lay hands on patients. But there is a huge percentage, very high percentage, a very high proportion of overall medical encounters that can be done through a telehealth technology. Is it 25%? Is it 30%? I think that we're only at the beginning of really tackling all that can be done virtually. And it's that aspect of the healthcare system that we seek to continue the forward momentum and allowing for providers and patients to have the option to use technologies that can meet the standard of care.
All right, Kyle, you're kind of like a Washington insider. You got your ear to the ground over there. What are you hearing among like those policymakers, the lawmakers? Like, what's the sentiment? Do you think like, I mean, we won't hold you to it, but is the sentiment there to extend these favorable policies to make sure that virtual care and telehealth continues the way that it was kind of in an unencumbered, free-loving state during the pandemic? What do you think?
Well, I'll say a few things. One is there is not an elected or appointed policymaker in this country at the federal level or the state level that will not start any remarks about telehealth in any other way than very positive. If the jury was out prior to the pandemic, it's come back in resoundingly. And from a public policy perspective, the verdict is very clear. Telehealth is a positive, and it was a silver lining of the pandemic. It needs to remain a permanent option for Americans moving forward. We need to build upon the positive momentum that we have as an industry and a community coming out of the pandemic. So every policymaker will start their remarks very positively. At the federal level, that's a great example of that, is the fact that we went from an extremely supportive administration in President Donald Trump's administration, supportive of telehealth, that gave way after the 2020 election to an extremely supportive Biden administration that is saying all the right things about telehealth and making clear that they want these, federal flexibilities to be made permanent. We've got bipartisan support in Congress. We've got clear support in the House. We've got clear support in the Senate. The incoming Republican Congress doesn't change those dynamics at all. The Republican House is going to be very supportive of telehealth. It's a huge part of their blank, actually. Earlier this year, on a bipartisan basis, we were able to extend for 151 days post the end of the pandemic all the various telehealth flexibilities directly tied to Medicare, for instance. And we've got all the right bills in place, introduced on a bipartisan basis, to make all of our key priorities that I mentioned previously permanent. So I think in the long run, even though Congress might kick the can, even though Congress might make us sweat it out, and maybe Congress will only act when their back's up against the wall, I'm very, very optimistic that we are going to be on the road to permanency for the vast majority of federal flexibilities that have come about during the pandemic. And at the state level, whether it's leveling the playing field for telehealth, making sure it's robustly covered and reimbursed by commercial coverage and by Medicaid coverage, and breaking down those interstate barriers to care on a state-by-state basis, we're going to continue that positive momentum, and we're going to continue to make sure states adopt these positive laws and that there's no going backwards. And so we have to remain vigilant. We've got to do our job. We've got to make sure that policymakers at the federal level and state level are hearing from us. But really, I wouldn't want to trade positions with any other organization in terms of the issues we're advocating for, because we're in a rare issue, a healthcare issue, nonetheless, where we have extreme and extraordinary across the board bipartisan support.
Yeah, bipartisan agreement is not a phrase one has heard quite often during the last 6, 7, 8 years. So this is great. I'm happy to hear that that's your read on it. All right, I want to ask one other thing before we wrap up. I'm curious about the reimbursement side of things. So you mentioned the commercial payers at the state level, and then Medicare, Medicaid at the federal level. What's happening there? Because I remember having these conversations very early days, back when ATA was a quirky little a subset meeting of a much bigger thing, and before we blew up, and things have become omnichannel in nature. There was always this talk of reimbursement at parity to an in-person visit, and I know that in some cases that is the case, and in other cases it's not the case. What are you hearing, or where do you think things are going to land in terms of reimbursement around telehealth visits? How much is it going to vary?
Yeah, it's going to vary, and there will be distinctions in the various policies. But one trend is clear. We're in a much better place as an industry and as a community in terms of coverage and reimbursement than we were prior to the pandemic. Just about every payer in the country covers and reimburses for telehealth services to some degree or another. There are virtually no exceptions to that. And that's not by accident. That's by the hard work of organizations like the ATA and ATA Action and all of our wonderful members that really represent the width and breadth of the U.S. healthcare system. So we've got the coverage, we've got the reimbursement. It just varies by the various payers. In terms of Medicare fee for service, the physician fee schedule continues positive momentum for Medicare beneficiaries, and it really sets the standard for other payers. So we've been able to make sure that telehealth technologies are being robustly covered in the physician fee schedule that covers Medicare fee for service. And we've also locked in a higher rate of reimbursement that's been in place since the beginning of the pandemic for the remainder of 2023. I will say for Medicare, we're not going to get to these issues of reimbursement in the long term unless we remove the regulatory roadblocks that will come back into place if we don't get Congress to act. You'll never even get to the discussion of reimbursement if you don't take care of some of the fundamental regulatory hurdles in a permanent way. At the state level, we're continuing to see that positive momentum. We're continuing to see commercial payers at the forefront of offering this to their beneficiaries. And there's really no state Medicaid policy in the country that isn't offering some form of telehealth coverage. It's just that some states are more robust than others. And it gets complicated because you can start really getting granular and breaking it out by various technologies and services. But on the whole, very positive direction. And I think we'll continue to see more robust coverage and reimbursement of telehealth moving forward. Again, very optimistic about that.
I feel like it merits saying here that, for those who have not recently checked out the ATA website, wow, is that a wealth of information about everything. So you talk about that granular level, and it is like there is like a tracking spreadsheet for everything, whether it be reimbursement rates or whether it be some of these policies as they're moving through different legislatures at the state and federal level. So I have to shout you guys out for that, for putting that out there, and in a way where folks who are interested in this space can really learn more about what they need to learn about in order to continue delivering care and to continue figuring out how to advocate for these different policies that help keep this favorable environment for us. So kudos to you on that. And also to your conference coming up next week. I'm sure there'll be a lot talked about there. Last thing for you, Kyle, leave us with like, I don't know, a slight prediction for the future here. Get your crystal ball out. 2023. I mean, public health emergency stuff, obviously going to be a topic of conversation. Is there anything we need to be worried about? Like, is there any surprise, crazy thing that we should just be aware of right now before we head into next year so that we can be, get smart on it in advance, advocate for it, be ready to go and line up with the ATA and ATA action as they try to continue to advocate for these favorable policies for our industry?
Yeah, no, absolutely. It's a great question. So, organizations need to be prepared for the potential end of the public health emergency that could come as soon as early 2023. Right now, we have the public health emergency in effect until mid-January. We expect it to be renewed. Could get us into the second quarter of 2023. However, at some point, the public health emergency will come to an end, and organizations need to be prepared for the various contingencies that could really emerge from the decision to end the PHE. Right now, we've got 151 days of flexibilities post the end of the PHE for most of the Medicare-related flexibilities. However, we're fighting like hell to make sure that the high deductible health plan issue that I mentioned goes past the end of this year. Organizations need to be prepared for the potential that ends and what that could mean for them. Also, there are items that are directly tied to the PHE that aren't included in that 151-day window, like the remote prescription of controlled substances, like telehealth as an accepted benefit, like the really innovative acute hospital care at home program that's been put in place that's very conducive to the use of telehealth technology. We've got to make sure that there are plans in place to continue to really maximize the benefits available to the American people, regardless of what might happen to these policies in 2023. So the big surprise might be something that's relatively predictable, but it's still been more than 3 years in effect by the point that we get into 2023, which is the eventual end of the public health emergency.
What do we do? And when do we need to do it by, Kyle?
Now, your organization should be prepared for it now, but we've got a lot of reasons to be optimistic. But if you're not involved in an organization like the ATA, if you're not involved in our advocacy work that we're doing through ATA Action, there's no time like the present. You've got to get involved. For so many organizations, it's an existential question of how we keep this positive momentum forward. And while we have our ducks lined up in a row, while we're doing all the right things, there's always more to do. There's always more voices that should be added to that chorus. We've got to make sure that there's no American that goes off that telehealth cliff, loses access to virtual care, access that they have now. So we need to make sure that that momentum continues into 2023, even if something like the public health emergency does finally come to an end.
Absolutely. Well, hopefully, I mean, I think this is the right audience to be making that appeal to, because most of them, their businesses include some sort of element of virtual care. So you guys get out there. Kyle, thank you so much for stopping by. Good luck with the event next week. ATA Edge. Again, that's the policy conference being held in DC, sponsored by the ATA, December 7th through the 9th. Check that out. Still not too late to go. And if you're so moved to jump on to the ATA bandwagon or to check out ATA Action, which is the affiliate advocacy organization of the ATA that Kyle's the executive director of, head on over to their website and check that out. Kyle, thank you again for joining us. Thank you. It's so exciting to hear what's going on, because I feel like we've come so far as an industry waiting for all of this stuff. We're still kind of figuring out what's next, but it's I hope a call to action that the people who watch my show and those who are out there and in this space and want to continue to advocating for good coverage of virtual care take seriously. So thank you so much for joining us.
It was a real pleasure. Thanks so much for having me.
All right, everybody, that's Kyle Zeldley. He is the Senior Vice President for Public Policy at ATA. You can check out more interviews with the who's who of health tech as they are changing the way that we do healthcare on my YouTube channel. It's over there at youtube.com/WTF Health. I'm Jessica DeMassa. Thanks so much for joining us. Take care.